We're all born with a certain number of fat cells, and with changes in lifestyle, genetics, hormones, life events, they go up and down throughout our lifetime. And in terms of fat cells, we have superficial and mid-fat, and then we have end organ fat. Now, when it comes to superficial and mid-fat, we can debulk and decrease. We can plug you into a machine to give you the perfect silhouette you want. The end organ fat is visceral fat. And this is where your cholesterol lies, this is where all the bad stuff happens, and it increases your risk for things like diabetes, cardiovascular disease, and general inflammation. So currently, there's a movement called metabolism biohacking with something called GLP and GIP-1 inhibitors. And what they are, they're actually hormones that tell your brain that you're full, i.e. they cause gastric paresis. They paralyze your stomach muscle, and it tells your brain a signal that you're full, you don't need to eat anymore. And in effect, you end up using your fat stores, and you burn the fat stores. But fundamentally, you will lose weight, but the problem you've now got is the predetermined areas that God has decided for you to have fat in, whether it's your bra puffs, whether it's your submental, whether it's your lateral thigh. These are the last things to go. And what you have to remember is that if you're changing one hormone in the hormonal symphony, then the other hormones will have a combative effect. So you've got to be very careful when you're deciding to use these drugs. When we look at metabolism biohacking, the first thing we want to look at is medical causes that could cause your possible weight fluctuation. Could it be from secondary to hormonal problems such as hypothyroidism? Or is there insulin insufficiency? Are you pre-diabetic? Or do you have metabolic syndrome? Or are you perimenopausal? Or have your hormones changed? So the first thing we want to do is get the diagnosis correct. And the next thing we want to actually look at is the amount and quantify the amount of weight you want to lose and in what time period, and what have you done to lose that weight. Then what we'll do is we'll undertake a blood test to make sure you're medically compliant to be allowed these drugs, because what goes up must come down, and you don't want to yo-yo in weight. Now, if you look at the GLP-1 and GIP inhibitors, you've got Saxenda, you've got Wegovy and Ozempic, and then you've got Mounjaro. Saxenda has a lower side effect profile, but it also, in terms of outcomes, is the least clinically effective. And then you go all the way to Mounjaro, which is the most clinical effective, so rapid weight loss with rapid side effects. And what are these side effects? Nausea, vomiting, dumping syndrome, diarrhea, excessive burping. But also, if you lose weight rapidly, what happens to your body is it protects the major organs first, because your body's going into shock. So what you're going to notice in 3 to 6 months after weight loss, you're going to have hair shedding. You're going to notice that you're sunken and your skin is swollen. And then also you're going to notice that wherever you have fat and the fat has disappeared, you're going to get laxity. So you're going to have skin hanging from different areas. So when you're considering these modalities, you have to do it in a slow, controlled way with an expert physician who's seasoned in this approach. In terms of the way we approach you, we do baseline bloods, and then we look at which modality works for you. We wouldn't go to Mounjaro first line, because once you reach tolerance to the highest dose of Mounjaro and you've lost all that weight, where are you going to go next? The last thing you want is rebound weight gain, okay? So what we want to do, we find in our darker skins and darker hair types that Saxenda works better, but because it's once daily injection, not a lot of people prefer it. So we start in the middle with Ozempic and Wegovy. We start at the lowest dose possible, and we wean you up slowly, and we monitor your weight loss. In the same time you're on these GLP-1 and GIP inhibitors, we also put you on something called peptides. Because the last thing you want to do is you want to lose all that weight, but you're also going to lose muscle. And you need muscle for your basic metabolic rate to stay the same. If you lose muscle and you've lost weight, once you get off these drugs, you're going to put that weight on very rapidly. So we put you on something called ipamorelin. We also put you on something called CJC, which is a fat-burning peptide to maintain your metabolism. We then turn around and also combine it with fat loss IVs. And like I said, we wean you up slowly until you reach tolerance at that dosage, and then we carry on. And then we wean you down slowly as well, and we hold your hand throughout the whole procedure, and we do routine blood testing. Because the last thing you want is actually to buy a wonderfully new wardrobe and put all that weight back on again, and you can't use it. You can give it to me, yeah.